that's the point actually. We shouldn't give anything for free. We at least keep the cost very low. Admits affordable. Okay.
Yes.
Like likewise in the education industry, a very much revolutionary like Alak Pandey sir has just now started that giving education at a very minimum cost. A very minimum cost is actually needed because one should because everyone have to survive in this world because no one can give anything for free. It's just for to say.
You are contradicting yourself that no one can give anything free.
So
And
where I've said that I can give
previously
it
you have
free.
said that you will give money to people.
I would help in. I would not give anything. Okay, I would invest money in in schemes
That's good.
in like reaching people.
Okay, Aditya.
That is not.
I won't give like
What
cash
type
to
of
anyone.
schemes you will? What types of schemes?
I would definitely contribute myself to government schemes.
How
only
many,
because-
Aditya, we need to
because the
remove
government
this type
schemes
of
are
websites?
very much reachable. As an individual, if I would try to make any scheme, then I don't think that it would become very much popular.
So Aditya, invest on government
You can do
schemes.
it alone.
No, I'm not saying that I would do
So
it alone.
Aditya, how many, Aditya, we need to improve this type of management?
It is said to be that the government doctors, they are not serving well as compared to the private doctors. Like you are following in the same track, like you want to crack the NEET examination, or you will go into the same way. Okay, so will you do the same thing, or how you will win the soul or the confidence of the local peoples? Like in our societies, the poor peoples, they do not get the adequate medical facilities because the
No,
doctors are not
definitely.
punctual,
Yeah,
they are not
definitely, sir.
treating well, they are not examined, okay, and they are just making excuse, as well as whatever we have the government hospitals right now in our countries like AIMS, RIMS, whatever we have.
Okay, when in future when you will become a doctor and there will be some serious case like an operation and you think that no, I can't do that operation, it is very tough, maybe that person will lost his life, then also you will quit because according to your psychology or principle, either you will be at top or at bottom.
No, I would like to correct you on this. If my teachers, my professors are not satisfied with me, then how would they pass me even? So,
No, it is a hypothetical question and answer according to that.
like you were saying that if I would be a donation doctor, okay, and I would get some operation, then and if I failed, then my perception went wrong. That's what you were answering.
No,
Aditya, do you think
in
that-
your chemistry examination you said that I quit because either I want to be at top or at bottom, then maybe in future if you will become a doctor, then also if a serious condition will come and if you become a surgeon, then maybe you will quit because you cannot save that person's life.
No, that doesn't happen actually. I'm just explaining you why it doesn't. Because right now I'm preparing for government colleges, like and there faculties are very good. They even turned a very low-minded person to even a very great-minded person. So they first used to they first analyze you, they train you. They even make your perception change, and if they are able to make my perception change, then I would definitely go for it because I never think that I'm the only correct person, and I always believe in learning things, and I learn everything from my life, and I just want to add one thing that when I was out of my city, so my father once called me and asked me about my preparation, so I very much aggressively I said that I'm not gonna fail, okay? So I got, but actually did. So I got lesson that.
I want to suggest you that she had given you a circumstance that what will you do because you have failed in your chemistry exam. I will suggest you that in chemistry exam you have failed, but you got the second chance. But during operation you don't get second chance. So you try hard on that.
Yeah, I would definitely. Yeah. I would commit I would I would accept my mistake, and I would try to improve myself in every aspect of my life.
In that situation you don't left it incomplete.
No, I wouldn't. I would try my best.
Okay, Aditya, do you think that you have stated that you have got fail rank in class 12? So do you think that you can clear NEET examination?
Yeah, definitely.
And how will you clear? What is the blueprint of yours to clear this exam?
The first thing that I have got very much confident because I'm not overconfident because as for your information, overconfident is actually a relative term. It means if I'm saying that very aggressively, then maybe you could pursue me that I'm very much overconfident. But in my heart, there is still a chance that yeah, I'm saying this, then I have to do for it. After this, I have to do this then only I would do it. So if I'm saying something very much aggressively, then it doesn't mean that I'm very much overconfident. The plans are making in my.
That what is the blueprint of yours to clear this examination? Why are you trying to divert the topic?
Because I'm saying you because actually NEET is not very much tough examination. It just requires very much patience, and I'm not even bad at that. I'm not even to get some lessons. Not understand. I do understand them. I can even solve questions. I can even sit for various hours. But due to some reasons I couldn't make it this year. But I would definitely do it next year.
Have you appeared for any mock?
Aditya, as you mentioned that you before some time you are a rude person. So the same question from my side: how you converted from a rude person to a polite one?
I did this by respecting everyone, especially from my juniors. I started respecting my juniors first of all, because if you respected juniors first, then only you would get the motivation to respect your elders first.
Okay.
Elders thereafter. Okay. So I started my juniors. I always had an ugly fight with my brother. Then in some years back, but I developed a love bond with him in recent months. So he even afraid of me of asking question, but now he studies with me, so I can see the development in myself, and
Okay,
that's
my next question to you is what is your sole purpose to clear NEET examination? Why you want to become a doctor? What is your sole purpose?
actually sole purpose.
I want to add one more question. Could you please tell me why is Dr. considered to be the second God allowed over the
Yeah.
world?
Second God.
God, yeah.
Okay. Second God, because life is sustained in the hand of doctor only. If someone get injured, only he can do. Even he can do save the life. Okay.
And what
That's
is your
why.
sole purpose to become to clear
My first purpose is to serve the patient, serve the needy persons. Needy person in the sense like who are injured, who are in need of help. And second one is I'm very much fascinated about the brand of AIMS, so I just want to get myself graduate from there.
You said that you know the responsibility of a doctor. So can you highlight 5 major responsibility of a doctor?
Responsibility. If I've not even taken any demo from a doctor, but as far as I have seen my many movies like Munna Bhai MBBS, and there I got the point from Professor Asthana that he once said that you shouldn't be so much emotional, so much emotional. You should be very much focused, and you should be very much confident. Because don't be careful while doing surgery. Don't be careful. Just be very confident that you are gonna do it at once. Don't be careful. I've just taken one thing, that a person shouldn't be careful. He should be confident.
Okay, Aditya, can you say me that if you will be a doctor, and a good doctor, a famous doctor, then if you have to tell something to your I think the youngsters about your failures, so do you learn something from your failures? Will it help you to achieve your success?
I'd learned very many things from failure, because first thing that I followed APJ Abdul Kalam a lot. I do watch his videos even, and he sometimes said that failure means first attempt in learning. So that's what I followed, and I would follow it till my last breath. And definitely I would not get success immediately, but definitely.
So in order to be a doctor, what should we get? Degree or skill?
Both. Both. Degree and
Okay,
skill.
my
you're not
question to you
become-
that
Yes, sir.
right now in our societies, it is said to be that the government doctors, they are not serving well as compared to the private doctors. Like you are following in the same track, like you want to crack the NEET examination, or you will go into the same way. Okay, so will you do the same thing, or how you will win the soul or the confidence of the local peoples? Like in our societies, the poor peoples, they do not get the adequate medical facilities because the
No,
doctors are not
definitely.
punctual,
Yeah,
they are not
definitely, sir.
treating well, they are not examined, okay, and they are just making excuse, as well as whatever we have the government hospitals right now in our countries like AIMS, RIMS, whatever we have. So the people, they hesitate to go there, or they are just opting going to the private institute like Apollo, other hospitals. Like, so what you will take, or what you will do like that?
So first of all thing, first thing that I would like to do that I would highlight the issue policies that are issued by government on health schemes. Like I actually forgot the name which our Prime Minister had just launched.
You are talking about Ayushman?
Yes, sir. Yes, actually, Ayushman Yojana, है ना? So I would first.
It is for like a insurance. If you have the big diseases like that, for that these insurance is applicable. But the minor cases, like if I visit the Sadar hospital in Hazaribagh, if I am talking about the Hazaribagh, okay, if I have some fever, malaria, typhoid, which can be cured easily, okay, but despite of having such problems, if I approach to the government hospital, they are not treating well.
Yes, sir.
And
Because the reason is that the management is not actually well. The management is, as you know, that management is not doctors
who is
only.
the responsible? Who is accountable? The hospital authority. They are also part of
Yeah,
the doctors.
they are
also
only
doctors.
the management team is only responsible for that, because as a doctors, as a government doctor, because a government doctor is not being a government doctor is not an easy task. You should crack examination where as this year 22 lakhs students appeared in that. So in a race, if you get into some college, then you would have that much dedication. Definitely you would have that much dedication. Okay, you definitely you would you don't have any hunger for money
Do you
because
want to take some individual steps to remove that?
yeah, I would definitely, if I would get some leave, then I would definitely do visit to rural areas, because I do love villages more than cities, and I would spend my time, and I would arrange some some kind of government programs like functions, etc. I would try to convince the people of villages in their language only, because I just want to.
So you are talking about the big things, but as being a doctors, what can you do for the betterment of the people?
Yes.
First, only they are taking the monies from the government and they are not sitting properly. Like their working hour is 8 to 2 p.m. They are not properly punctuals. Okay, so how can you remove such kind of dissimilarities in our societies or in the people?
Sir, if I tell you honestly, then a
Because being
phrase is
doctor,
said. A
if
phrase
you are
is said.
doctor, okay, you should be punctual, you should treat, you should polite, okay, you should give the good or right suggestions to the patient, okay, so that they can get all the facilities which is available in the hospital.
Sir, thank you very much for asking me this question. A phrase is very much popular that अगर आप पैसा आपकी जिम्मेदारी के ऊपर हावी हो जाए तो आप अपने लक्ष्य से भटक जाते हैं. So definitely I would work on that, and I would not let it happen. I would always keep my responsibility as my first priority, and then only I would do my
Who is
best.
the health minister of our country?
Sorry, I don't know, sir.
Okay, what is the take of about the COVID-19 pandemic right now in the whole world? It was badly suffered, and India too. Okay, so in the future, okay, what you will take as being a doctor of the Sadar hospital? Like I am giving you the appointments. Okay, so what steps you will take to prevent or to be free from the COVID-19, especially in the Jharkhand or in the Hazaribagh cities?
So in Hazaribagh, the management was very well last year's. Because as compared to other cities like Mumbai, Delhi, the management did very well in Hazaribagh in controlling the kind of situation that was present in Hazaribagh last year. So the government is very much responsible for that. Even the police management, even the workers, and even the helpers who are giving foods to needy people who are sitting in the streets, or they spend their nights on our roadsides. So definitely I would join them. I would have joined them, if I would have been a doctor last year. Then I would definitely have been joining them, and I contribute my hands.
You are a doctor of Hazaribagh Sadar Hospital. Okay, so what you will take the steps to refrain from the
I would-
COVID-19 in the
I would first complain about the management to the hospital authority because the management is very much worse in Hazaribagh hospital.
Previously you have said that management was very good. Now you are saying that management is poor.
No,
You
where
will
I'm
complain.
saying.
You will not do anything.
No, I would complain then
pessimist.
only because what would I do? Because I have just a degree that I would serve the patient. That I just couldn't say anything to the management. I just
Don't
only
you
can.
think that as being a doctor you have to
I can
just
only
reach
give
the
suggestions.
people.
Like a regular
you have,
citizen
you
that
have to
I
be
have to
aware
complain.
about the people regarding social distancing, regarding the masking, regarding
Yeah, that's
So
the
you not
obvious.
say- you not
That's
say
the
this
obvious
thing.
thing that I
you
would say.
can't spend your money by
Definitely I would
people,
spend my
but
money, sir. Definitely.
by saying this thing, by preaching them, by advising them, you can control the 90%, I think.
Yes, sir. But I would
How much
definitely
money you will
do
give?
it. Yes, ma'am.
How much money will give to people?
Um,
It is not valid point. And by doing, if you can only do that, not all doctor will do that.
You don't think that serving
This is
people
the
freely is
reality of
better
freedom.
than giving them money?
sorry, ma'am. Please complete the question.
Serving people freely is better than giving them money, and I think you should give some other doctors money to start some clinic and treat the people freely so they can treat well. So I think that step is better than distributing money among the people, because I think there are in rural areas there are lot of houses where the husband are drinker, and if they got money because they will drink and they don't understand the value of money where they have to spend that.